Let me ask you something most men never discuss, even with their closest friends. Have you ever wondered if that decision made decades ago, or never made at all, is secretly affecting your performance today? Because here's what nobody's telling you. Whether you're circumcised or not could be impacting your sensitivity, your risk of infections, even your to maintain firmness as you age. And gentlemen, after 50, these differences become more pronounced, not less. I'm Dr. Laura Bennett, and after 15 years as a urologist helping thousands of men navigate these exact concerns, I'm going to reveal the uncensored medical truth about what really happens down there, with or without that protective sleeve. No judgment, no agenda, just raw facts that could change how you think about your most intimate health. Stay with me, because by the end of this video, you'll understand exactly what's happening beneath the surface, why some changes you're experiencing might be directly linked to this one factor, and most importantly, what you can actually do about it, regardless of your current situation. Gentlemen, let's start with what nature intended. That retractable hood, medically called the prepuce, isn't just excess skin. It's a sophisticated biological system with over 20,000 specialized nerve endings. Think of it as your body's built-in protection system, like the lens cover on an expensive camera. This natural shield does 3 critical jobs. First, it guards the most sensitive part of your anatomy from constant friction. Imagine walking around with your eyeball exposed all day. That's what your glands experiences without its cover. Second, it maintains a perfectly balanced microenvironment, keeping things moist and chemically optimized. And third, this is huge for men over 50, it preserves sensitivity that naturally declines with age. But here's where it gets interesting, because removing this natural feature, something millions of men have done, creates some surprising advantages that become especially relevant as we age. And the research on this is absolutely fascinating. Let's talk straight facts. Without that fold of skin, cleaning becomes remarkably simple. No more worrying about trapped bacteria or that whitish buildup called smegma. For men dealing with arthritis or reduced flexibility, common after 50, this simplicity isn't just convenient, it's essential for preventing infections. And speaking of infections, here's something that might shock you. Circumcised men have up to 70% lower risk of urinary tract infections. Why does this matter more after 50? Because UTIs in older men can lead to serious complications, including kidney damage and sepsis. That protective cut made years ago might be your secret weapon against these age-related threats. Now, this next part is controversial, but the science is crystal clear. Major studies, we're talking research from Harvard, Johns Hopkins, the World Health Organization, show circumcised men have 60% lower risk of HIV transmission. They also show significant reduction in HPV and herpes transmission. Why? Because that inner foreskin tissue is like a welcome mat for viruses. It's thin, moist, and packed with the exact immune cells that STIs target. Remove that vulnerable tissue, and you remove their favorite entry point. It's like closing a back door that burglars love to use. But gentlemen, let's address the elephant in the room. What about pleasure? What about that concern every man thinks but rarely voices? Here's the unfiltered truth. Yes, removing those 20,000 nerve endings changes sensation. The exposed glands develops a tougher exterior through a process called keratinization. Some men report no difference whatsoever. Others describe it like the difference between HD and standard TV. You can still enjoy the show, but the resolution isn't quite the same. And here's what's crucial for men over 50. If you're already experiencing age-related sensitivity changes, this factor becomes part of a bigger picture. The fascinating part? Your brain is remarkably adaptable. Men circumcised as adults often report that after an adjustment period, pleasure rebounds in different ways. The remaining nerve pathways actually become more responsive, compensating for what was removed. Now, for some of you watching, this isn't about choice, it's about medical necessity. Conditions like phimosis, where the foreskin won't retract, affect up to 10% of older men. Imagine trying to urinate through a pinhole or experiencing splitting pain during erections. For these men, circumcision isn't optional, it's liberating. Even more serious is paraphimosis, where a retracted foreskin gets trapped behind the glands, cutting off blood flow. This is a medical emergency that can cause permanent damage within hours. Men with diabetes are especially at risk due to increased swelling and poor circulation. Then there's chronic balanitis, recurring inflammation that turns your most sensitive area into a constant source of discomfort. When creams fail and infections keep returning, surgery becomes the permanent solution that finally brings relief. So how do you process all this information? If you're already circumcised, embrace the advantages: easier hygiene, lower infection risk, reduced STI vulnerability. If you're not, maintain excellent hygiene, stay vigilant about changes, and know that medical help is available if issues arise. Here's what's critical for men over 50. Your situation today matters more than decisions made decades ago. Whether you have foreskin or not, age brings changes: reduced elasticity, slower healing, increased infection risk. Understanding your specific anatomy helps you adapt your care accordingly. For intact men, daily gentle retraction and cleaning, watching for tightening or difficulty retracting, and immediate medical attention for any pain or swelling. For circumcised men, moisturizing to combat dryness, protecting sensitive areas during activity, and being aware that keratinization continues with age. Regardless of your status, never ignore these red flags. Pain during urination or erection, unusual discharge or odor, difficulty retracting, if intact, or any lumps, sores, or color changes. These aren't just inconveniences, they're your body asking for help. Look, I know it's uncomfortable discussing this stuff even with a doctor, but here's the truth. Urologists see this every single day. We're not judging, we're diagnosing. A 5-minute conversation could prevent years of discomfort or catch something serious early. Gentlemen, whether nature or surgery determined your anatomy, what matters now is knowledge and action. You can't change the past, but you can optimize your present and protect your future. Your intimate health after 50 isn't about what you have or don't have. It's about how well you care for what you've got. Remember this: every man's anatomy is different. Every man's experience is valid. And every man deserves to feel confident and comfortable in his own skin, however much of it he has. Your best years aren't behind you. They're waiting for you to claim them. If this information opened your eyes, hit that subscribe button for more Straight Talk Men's health content. Share this with a friend who needs to hear it, because real men help other men. See you later.